Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Dear friends, today in this video lecture we are going to see another culture test that is related to pleural fluid for culture and sensitivity test. So this is again the microbiology test. Okay, and in this video we are going to, and in this test we are going to see that how to perform pleural fluid for CS. Okay, so my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. So let's start the video. First of all, dear friends, we are going to see that what is the pleural fluid and what is the pleural fluid CS. Okay, so we are going to see the introduction. After that we are going to see the diagnostic purpose, that why we perform that test. After that we are going to see the specific media or culture media that we are using for the pleural fluid CS. Then we are going to see the requirements while performing that test. Then we are going to see the procedure. Then we will explain the most common bacteria that are found in pleural fluid CS. Then we are going to see that what type of the antibiotic we are applying when we get the bacteria. Then we are going to explain the most common biochemical test in this CS test. Then we are going to see precaution and limitation. First of all, let's start with the introduction. Now, what is pleural fluid? First of all, let's explain this pleural fluid. Remember, it is the liquid or the fluid that is thin, lubricating, okay, and it is mostly found in the pleural cavity. Pleural is actually the space that is present in the pleural membrane, remember, okay, and this pleural membrane is mostly found in in the lungs and mostly in the chest wall. So this is the pleural fluid. Then we have the function. So the main function is lubrication. It can maintain the surface tension. Moreover, it can protect the lungs. Now then we have pleural fluid for CS. So it is the culture sensitivity test in which we identify or we can find out or we can isolate the bacterial or fungal infection in the pleural fluid, and after that we will determine the most effective and appropriate antibiotic for the treatment. This is simple pleural fluid CS. Then we have the diagnostic purpose. So very simple, this test is specially recommended to find out the bacterial or fungal infection, and after that once the infection is found, so then this test is also recommended to find the suitable antibiotic that are specially used against the infection in the pleural fluid. Now, what type of the bacteria that are mostly found in the pleural fluid? We have different type of the bacteria. So the first bacteria we have Streptococcus pneumonia. So the percentage of the Streptococcus pneumonia is 10 to 30%, and it will be present in this pleural fluid when there is a pneumonia case. Okay, then we have Staphylococcus aureus. It will be 5 to 20% present, and it will be present at that condition when it is the post-surgical or post-traumatic infection case. Okay, then we have Peptostreptococcus and Bacteroides. So the percentage of this bacteria is 5 to 15%, and it will be present in case of aspiration. Then we have Haemophilus influenza, that is the 5 to 10%, and it will be present in case of pneumonia. Okay, then we have E. coli and Pseudomonas. So E. coli Pseudomonas will be present in case of hospital acquired infection, because it is the hospital acquired infection, and it will be 5 to 10%. Then we have Klebsiella, that is the 5 to 10%, and it will be present when there is abscess, when the patient is immunocompromised, and it is also hospital acquired infection. Then we have Mycobacterium tuberculosis, that will be the 1 to 5%, and it will be present when the TB case is positive. Let's suppose the patient is TB positive, So then the doctor will recommend to check the tuberculosis bacteria, to isolate the tuberculosis bacteria, and after that must see that TB case positive. So this mycobacterial tuberculosis will be present in case of TB when a patient have TB positive. Okay, so this type of bacteria will be present in pleural fluid, 1 to 5%. Then we have fungus, different type of the fungus like Histoplasma capsulatum and Coccidioides ammitus, that is 1%. It will be present in case of immunocompromised, and it is very less, means less than 1%, we can say like that. Then we have Legionella and Brucella. It will be also less than 1%. Legionella will be present in case of severe infection, and Brucella will be present in case of systemic infection. Okay, so this is all about the bacteria presence and their percentage. Remember, Streptococcus and Staphylococcus is the gram-positive cocci. Streptococcus is the also gram-positive cocci. This is also gram-positive cocci. And one thing more that's really important: these two bacteria are anaerobes. Haemophilus influenza is the Coccobacilli. E. coli and Pseudomonas is the gram-negative rods. Klebsiella pneumoniae is also gram-negative rods. Okay, Mycobacterium tuberculosis, actually it is the ZN bacteria, we can say, or acid fast bacteria, and it is also what? It is also gram-positive. It is also positive rods. It is also rod shape. Then we have Legionella and Brucella. So Legionella is the gram-negative rods and Brucella is the gram-negative Coccobacilli. So this is the shapes and this is the percentage of the bacteria, and that's why the bacteria, and these are the main condition in which the bacteria can be present in pleural fluid. Now let's explain the culture media that we are mostly using when we are performing pleural fluid CS. So we have blood agar. All of you better know that blood agar is the general purpose media, and it can provide or it can support the growth of many bacteria. Okay, then we have chocolate agar. So chocolate agar is actually we can specially use it for the fastidious organism. So in this case we have H. influenza is the fastidious organism, so we use chocolate agar. Then we have McConkie agar, that is specially used for the gram-negative rods like Klebsiella, E. coli and Pseudomonas, Legionella, etc. Then we have Lewiston and Jensen agar, that we specially used for the Mycobacterium tuberculosis. We have Middlebrook media, that is specially recommended for the Mycobacterium tuberculosis. We have Brucella agar, as the name indicates, so it is selective for the Brucella. So these are all about the culture media. Then we have the biochemical test. So the first biochemical test is catalase coagulase. It is specially used for the Streptococcus. Catalase is specially used for Staphylococcus and Streptococcus bacteria. Okay, then we have urease test, that is specially used for the Klebsiella because Klebsiella and Brucella, because Klebsiella and Brucella are urease positive. Then we have indole test, which is specially used for the E. coli. Then we have citrate test, that is specially for the Pseudomonas. Then we have gram stain and Zn stain. So gram stain is specially used for every type of the bacteria that are gram positive and gram negative, and Zn stain is used for the acid fast bacterium like Mycobacterium tuberculosis. Then we have triple sugar iron test, that is used for the GNR, gram negative rods. And we have API testing, it is also used for the gram negative rods. So these are the most common biochemical tests that we are performing during pleural CS. Then we have requirements, that what we required while performing that test. So we need ethanol, which is specially used to disinfect the surface at the top area or the surface area where we perform the work. Wire loop is specially used for the streaking. These are the personal protective equipments that are specially used to protect ourselves from the infection. Incubator is used to provide incubation like 37 degrees Celsius for the bacterial growth. Spirit lamp is used to provide clean environment, means 4 to 5 centimeter it can provide the or we can also sterilize the wire loop, red hot the wire loop through this spirit lamp. We have antibiotic disc that is specially used for the bacteria, means for the bacteria sensitivity, to find out the sensitivity or to find out the profiling of the bacteria, so that's why it is used. We have autoclave that we can use. So autoclave is specially used for the to sterilize all the glassware materials. These are the this is the LFH that can provide the clean environment. So in the LFH we have to perform all the test, all the culture test. This is the specially aspiration needle, or we can say syringe, through which we can take the pleural fluid from the chest portion, or we can say from the ribs or chest area. This is the pleural fluid syringe. Now let's see the procedure, that how to perform that test. First of all, what will you do? You have to collect the pleural fluid sample in a sterile syringe as we talked. Then you have to take our loop. You will red hot it, means it can be sterilized using spirit lamp. Then you will let the wire loop to be cool. During that time, what will you do? You have to place one small drop of the fluid of this pleural fluid onto the selective media as I talked, and then you will streak it. After that, you will incubate the plate for 24 to 48 hours, 2 to 7 days, 1 to 4 weeks, and 2 to 8 weeks. Okay, it can depend upon on the bacteria. So remember, if you are isolating streptococcus or staphylococcus, so you have to incubate the plate for the 24 to 48 hours. Okay, if you are isolating streptococcus, staphylococcus, E. coli, Klebsiella, Pseudomonas aeruginosa, Haemophilus influenza, so you have to keep the plate for 24 hours. If you are isolating the let's suppose Legionella, so you have to keep the plate for 2 to 7 days. So this is the incubation of the Legionella. And if you are isolating let's suppose Brucella, so you have to keep the plate for 1 to 4 weeks. And if you are let's suppose isolating TB, so the incubation period is 2 to 8 weeks. Then we have the biochemical test, so it is very important. So once the bacteria is isolated, so then you will perform the biochemical test as we already talked. Then you have to make the bacterial lawn. Okay, once the bacteria is identified, then you have to make the bacterial lawn onto the media like blood agar or MHA media or nutrient agar. Then after that, what will you do? You have to place the proper antibiotic according to the bacteria, which we will explain in the next slide, and it will give you the sensitivity report or resistant and intermediate report of the microbes. Then after that, you will report the test. Okay, if it is growth, so then you will mention the growth of the bacteria. If it is not growth, so then you will say no growth of any microbes obtained after 24 hour or 48 hour or 1 to 4 weeks incubation. Okay, this is how the reporting. Now let's see the antibiotic profiling according to bacteria. First of all, we have streptococcus. So if let's suppose you isolate the streptococcus pneumonia, so the antibiotics you must use is ampicillin. This is the amoxicillin ml, ampicillin, levofloxacin, moxifloxacin, ceftriaxone and cefotaxime. So we have almost 6 antibiotics. You will use 4 more antibiotics to make the report valuable. Okay, so for one bacteria you must use at least 10 antibiotics. It will make your report valuable. Then you have staphylococcus. So when staphylococcus is isolated, so then you will have to use vancomycin, cefoxetine, linezolid, fusidic acid, amikacin, ciprofloxacin, tigecycline and doxycycline. By using these antibiotics, you will also found either the Staph aureus is MRSA or MSSA. Then you will have to use these antibiotics when you have Haemophilus influenza. So in case of Haemophilus influenza, you have to use amoxicillin plus clamminamic acid, cefotaxime, ceftriaxone, levofloxacin and moxifloxacin. When Klebsiella is isolated, so then you will use cefotaxime, ceftriaxone, tazobactam, salzone, or we can say cefoperazone plus sulbactam. Then you will use imipenem, meropenem, ceftazimide, and cholecystine. Okay, so almost this is the 8 antibiotic. Then you will use 2 more antibiotics. Now then we have Mycobacterium tuberculosis. So in Mycobacterium tuberculosis you have to use isoniazid. This is the isoniazid, rifampicin, ethambutol, parazinamide, levofloxacin, and amikacin. For Legionella, you must use azithromycin, clarithromycin, levofloxacin, moxifloxacin, and doxycycline. For Brucella, you have to use doxycycline, amikacin. This is the gentamicin and streptomycin. For fungi, you have to use itraquinazole, amphotericin B, fluconazole. This is the voriconazole, and we have capsofungus. This is a type of fungal drugs. So when you found E. coli, so you have to use cefotaxime, ceftriaxone, amikacin, tazobactam, salzone, or we can say cefoperazone plus sulbactam. You have to use imipenem, meropenem, ciprofloxacin, fosfomycin, and gentamicin. When Pseudomonas comes, so then you will use tazobactam, salzone, imipenem, meropenem, ciprofloxacin, levofloxacin, polymyxin B, cholecystine, ceftazimide, cefepime, and gentamicin. Okay, so these are the antibiotic you must use. And one thing more that I already tell you, that you must use 10 antibiotic for one bacteria. Okay, now let's see the limitation and precautions. So the first limitation and precaution is that you must collect the sample at morning time. You have to use sterilized syringe. You have to clean the working area before and after use. You have to collect the sample. Once the sample is collected, so then it immediately be processed within 1 and 2 hours, otherwise there will be contamination. And if you are not using it, so you have to store it in refrigerator. That will slow the bacterial growth. You will label the sample once it come. Then you must use quality control and appropriate culture media. It will show the handling as well as the media, that either the media is means usable or not. So quality control is very important. Then you must use gram staining. You must perform gram staining and biochemical tests, due to which the bacteria is correctly identified. You have to follow the CLSI guideline when you are finding the antibiotic sensitivity or antibiotic resistance or intermediate profiling. After that, you have to get the patient that do not take antibiotics before 1 week of the CS test. Then you must avoid the bacteria and fungus. If you found the bacteria and fungus which I told you, if you found other bacteria and fungus as compared to this microorganism, as I already told you, then you have to ignore it. Then you must ask the patient history and age, sex. This is really important. It will clarify your doubts, and it will give you more accuracy for the result. So this is all about the Pleural culture sensitivity test. Thank you so much for watching. I hope you like this video. If you like this video, so make sure to hit the like button, share this video, and definitely subscribe the channel to get more interesting videos like that. Thank you so much for watching.